So, good morning, ma'am. I am Hannah May D. Nguyen, student nurse from Davao Doctors College. So, today, I'm going to re-demonstrate the abdominal assessment. So, in preparation, prior to performing the procedure, check the doctor's order for the need to perform the assessment. So, the purpose of this is to verify the doctor's order. So, I check that there is a doctor's order for the abdominal assessment. And then, perform hand hygiene. And apply gloves. And observe proper infection prevention procedure. So that is to reduce the spread of microorganisms and prepare the equipment. Prepares equipment needed for the assessment. So, for abdominal assessment, I would be needing a stethoscope, a pen light, and a tape measure. And then, introduce self and verifies client's identity using agency protocol and explain to the client on how she may able to participate in the following assessment and the need to assume several positions in the assessment. So, good morning, ma'am. I am Hannah May D. Nguyen, student nurse from Davao Doctors College. Today, I'm going to assess your abdominal. And, ma'am, can I ask for your name?
Edna,
Your birthday, ma'am?
October 21,
Your age?
52.
8. Check na ko sa wristband. Thank you. And then, ask the client to empty her bladder before beginning the examination and ensures that the room is warm, and then ask the client to remove her clothes and put on gown. And then, drapes the client with sheets so that the abdomen is exposed. And then, instruct the client to breathe through the mouth and deep breaths. And then provides for client's privacy for the client's dignity. So, assessing the abdomen. Inquires if the client has any history of the following: incidents of abdominal pain, tender areas, like location, onset, sequence, chronology, and frequency, associated symptoms like constipation or diarrhea, change in appetite, and food ingested in the past 24 hours. So, ma'am, have you have any of that? Like, do you experience constipation, diarrhea, or change in appetite?
No.
Okay. And then, assist the client to a supine position with the arms placed sideward for the comfort of the client, and place small pillows beneath the knees of the client and expose the client abdomen only from the chest line to the pubic area to avoid chilling and shivering. So, ma'am, can you flex your knees? And below here. Okay. And then, inspection of the abdomen. Inspect the abdomen for the skin integrity, coloration of the skin, vascularity of the abdominal, any scars, lesions, and rashes, vascularity of the any lesions or rashes. So I observed that the client's abdomen is uniform in color and no lesions. And then it is unblemished skin and no stretch marks. So for that, I observed that the client's abdomen is just normal and no any lesions. And then inspect the abdomen for contour and symmetry. So I observed that the client's abdomen is flat and rounded. And then client to take a deep breath and hold it. So this is to observe the client's breathing. So while the client would deep breath, you can see each of the client when it expands.
You can observe
So,
the enlargement of the liver.
Okay. So observe that the client's her abdomen. And then so inspect the abdominal movement with the client breath. So observe that there is no any abnormal of the abdomen of the client. And then assess the symmetry of contour while standing at the foot of the bed. So I'm going to assess the symmetry of the abdomen of the client. So while checking here the foot. So it is symmetric. And then if this tension is present, measure the abdominal girth by placing a tape around the abdomen at level. So if you observe any distension present of the client's abdomen, you're just going to use your tape measure and going to put it here. Then you're going to measure it by this one. It's going to be. And then observe the abdominal movements associated with respiration, peristalsis, or aortic pulsation. I observed that visible peristalsis in the client and no visible vascular patterns that I observed in the client. So, auscultation of the abdomen. Auscultate the abdomen for bowel sound, vascular sound, peritoneal friction rubs, and then warm the hands and the stethoscope diaphragm. And then, for bowel sounds, use the flat disc diaphragm because flat disc diaphragm is a high pitch and it is good for intestinal sounds. Place the diaphragm of the stethoscope in each of the 4 quadrants of the abdomen and listen for active bowel sounds, irregular gurgling noises occurring about every 5 to 20 seconds. So, going to do the auscultations of the 4 quadrants, which is the right upper quadrant, the right lower quadrant, the left upper quadrant, and the left lower quadrant. So, for this, we're going to hear for active vowel sounds. as I auscultate, there is an audible vowel sounds and some gurgling sounds, but it is just normal. For vascular sounds is uses the bell of the stethoscope over the abdomen and then listen for bruits and peritoneal friction rubs. So there is some points that you're going to auscultate for the vascular sounds. So I'm going to use the bell side. So, as an auscultate, there is an absence of arterial bruits. So, percussion of the abdomen. Percuss several areas in each of the 4 quadrants to determine the presence of tympany and dullness, and then percuss the liver in the right lower quadrant at the mid-clavicular line and percuss upward. Note the change from tympany to dullness, and then also percuss the spleen. Begin the posterior to the left mid-axillary and percuss downward, noting the change from the resonance to spleen in dullness. So, I'm going to percuss the abdomen of the 4 quadrants. So, there is some points that you're going to percuss. So, observe the change in the sound from tympany to dullness. So, the tympany over the stomach are gas-filled bowels. So, there is no large dull areas as I auscultate. And the next is percuss the liver, begin in the right lower quadrant, and then percuss the spleen, begin in the posterior to the left mid-axillary. So our client needs to sit down as I will percuss the spleen. So, ma'am, can you stand up, ma'am? Ma'am, ay, sit down lang, ma'am. Okay. So let's start in the mid-axillary line, the left side. So observe the change in the sound until gonna reach the spleen here. So it is from the resonance to dullness here in the lower part. So, assist the client to a supine position again. Thank you, ma'am. And ensure that the client and then performs blunt percussion on the liver. Percuss the liver by placing the left hand flat against the lower right anterior rib cage and use the ulnar side of the right side fist to strike the hand. So, the liver is located the right upper quadrant. So, left hand over, and then ask the client to inhale to deep breath. So you're gonna observe if there is an enlargement of the liver. You're gonna observe also after the percussion of the liver is gonna palpate the palpation of the abdomen. So instruct the client to sit with his or her back to you to perform blunt percussion on the kidney by placing the costal vertebral over the 12th rib using the ulnar side of the right fist to strike for left hand. So, ano lang ma'am ha? So, we're going to percuss the liver. So, in the 12th rib, going to percuss, inhale ma'am. Going. Okay. So, light palpation. Hold the palm of your hand slightly above the client's abdomen with your fingers parallel to the, and then depress the abdominal wall lightly about 1 centimeter or to depth the subcutaneous tissue with the pads of your finger, and then moves the finger parts in a circular motion and notes the areas of tenderness or suspected pain, muscles, and muscle guarding. To determine the areas of tenderness, ask the client to tell you about them and watch the changes in the client's facial expression. And if the client is excessively ticklish, begin by pressing your hand to the top of the client's hand while pressing lightly. Going to do a light palpation. So, ma'am, just ask me if you feel anything while I'm going to palpate your abdomen. If there is any. So, ma'am, do you feel anything? No? So, as I palpate the client's abdomen, the client does not feel any pain or tenderness. And then for palpating the spleen, stand at the client's right side and reach over the abdomen with your left arm and place your hand under the posterior lower ribs and pull up gently. Place your right hand below the left costal margin with the fingers pointing toward the client's head and ask the client to inhale and press inward and upward as you provide support with the other hand. So, going to palpate your spleen, ma'am. So, just as I palpate, ma'am, inhale, can you inhale and exhale, ma'am? So, there is no enlargement observed as I palpate the spleen. So, next is palpate the kidneys. To palpate the right kidney, Support the right posterior flank with your left hand and place your right hand on the right upper quadrant just below the costal margin of the MLC, and to capture the kidney, ask the client to inhale, then compress your fingers deeply during peak, and ask the client to exhale and hold the breath briefly. Gradually release the pressure of your right hand. If you have captured the kidney, you will feel it slip beneath your fingers. So use your left hand here and your right hand, and then ma'am, inhale ma'am, hold your breath, exhale, and then to do it in the left kidney, just reverse it. Ma'am, inhale. Okay, so there is no pain as I observed with the client and no enlargement. And then palpate the urinary bladder. Begin at the symphysis pubis and move upward and outward to estimate. So usually the urinary bladder can be located here, and we're going to locate it because we cannot expose the client symphysis pubis. So just going to palpate here in the urinary bladder. Test for ascites. Test for shifting dullness. So, while ensuring that the client is in a supine position, percuss the flanks from the bed upward. Note the change from dullness to tympany, and help the client turn on the side and percuss the abdomen upward. So, percuss upward. And note the change from tympany to dullness. Ma'am, can you turn side? Make sure that the client is still comfortable while you're doing this. So the next indicator of ascites is test for fluid wave test. So while ensuring that the client is still in the supine position, ask the client to place the ulnar side of the forearm firmly along the middle line of the abdomen. Firmly place the palmar surface of your finger and hand against in each side, and use your hand to tap the opposite side of the abdominal wall. So ma'am, can I ask for your side, ma'am? And then put a little pressure, ma'am, here. So for fluid wave test, we are assessing. You can indicate that the client have an ascites or positive for ascites if you induce this, as there would be a transmission of the wave that you can feel here in your hands. So that may be an indicator that you have an ascites. Thank you, ma'am. So I've observed there is no any transmission of wave or impulse that I observed. And then test for appendicitis or peritoneal irritation. So assessing for rebound tenderness. Palpate deeply at 90 degrees into the abdomen halfway between the umbilicus, and then listen and watch the client expression of pain. So there is many techniques that you can do it, but just use where you are comfortable. So it may indicate that the client have or positive for appendicitis, as is when you release the pressure, there would be, the pain would, the client will tell the pain if once you release the pressure there. So that may indicate for appendicitis. And next is test for referred rebound tenderness. And then assess for SOS sign. So ask the client to lie on the left side and then hyperextend the client right leg. Place the client in a supine afterward. So, ma'am, can you turn in the left side to hyperextend the client right leg. Okay. So, ma'am, do you feel any pain here? No? Okay. So, if the client would tell you that there is any pain right here, or as I lift her leg, is that may indicate that the client may have an appendicitis. So next is assess for obturator sign. So support the client right knee and ankle and flex the hip and knee and rotate leg internally and externally. So it's just mostly the same for the SOS sign, but here is ma'am, can you? Yan. Then right. So going to flex and the hip and knee and rotate leg internally and externally. So ma'am, there's any pain, ma'am? You feel any pain?
No.
No. Thank you. So the client is not feeling any pain or tenderness, so the client no any indication of appendicitis. Hypersensitivity test. So while ensuring that the client is still in a supine position or a neutral position, stroke the client's abdominal wall with a sharp object or drops a skin fold of the client and quickly release it, and do it several times. So that's it, the hypersensitivity test. And then next is test for cholecystitis. So press your fingertips under the liver border of the right costal margin and ask the client to inhale deeply and note for any increase or pain felt in the client. Going to use your fingertips and then, ma'am, can you inhale? Deeply, ma'am. And then, that's it. So, one indicator that the client is positive for Murphy sign is while I'm going to palpate the client is she's going to have an inhalation. So, next is palpation of the bladder. So, since that we cannot expose the client pubic symphysis if the client history indicates possible urinary retention. And then after this is informs the client that the assessment has ended and turns back to the client and cover. And then shows gratitude for the participation and cooperation of the patient and ensure that the patient is still in a stable condition before leaving the patient's room. So, ma'am, thank you for your cooperation. Your abdominal assessment has ended and I performs hand hygiene. So, it's important to perform hand hygiene before and after the assessment to avoid any contamination from you and also from the patient. And then document the findings and record it in the patient's record. And then that ends the abdominal assessment. And thank you so much.